Hello, I'm Dr. Sumi King. I'm a member of the OB Hospitalist team at a Texas hospital. And recently, I want to tell you about a life-save story that occurred at our institution. It was a typical day in the OBED. It had been busy all day long. The labor and delivery unit was full, and we had been having postpartum hemorrhage drills. We use a device called the Vocera at our institution to communicate fast calls, to alert the team to problems. And so when they were having the drills, those calls were coming over the Vocera as well. At about 17:09, a call occurred asking for the OB hospitalist to come to one of the labor rooms. I walked in thinking, is this a drill and it was the real deal. The coordinator nurse for the shift and the primary RN for the patient were attempting to get the patient into a hand-knee position. They've been having a bradycardia for 9 minutes from a baseline of 140s, and it was now in the 50s to 60s and had been that way almost continuously. They had checked her just prior to getting her into this new position, and she was a RIM and +1. I rechecked her. She was complete and +2 at that point. I explained to the patient and her support person quickly that we were going to have to expedite delivery as the heart tones were not recovering with this position either. And so we flipped her over, prepped her, and I had explained that if her maternal expulsive efforts were not adequate with the first time, hoping that she would be because this was her third baby, that I would be placing a vacuum. And that is indeed what we needed to do because she did not push well with her first attempt. The second attempt, we had a little baby boy who initially held his breath. There was a nuchal cord which was loose enough to reduce. We provided tactile stimulation and suctioning. He started to cough and breathe, did fine. I placed him up on the mother's chest for skin to skin with nursery personnel to take over care of the baby. And then the father of the baby got to cut the cord after all. We then began to manage the second stage of labor. And about 3 minutes after delivery, the patient's provider, who had been en route from the office, arrived. I gave report, and that physician took over. So the total time for the bradycardia from when it started was a total of 9 minutes before I got there and 6 minutes after. Within 6 minutes, we had formulated a plan and got her delivered when I walked in the room. So the value of having a hospitalist on site is that we can get a physician into the room immediately to expedite delivery when the provider is not on site and is having to drive in from their office. And depending on the community that you're in, that could be a long drive sometimes, especially around 5 o'clock, which this was with rush hour. So that was my life save story.